With us now is Dr. Norman Shealy, and he is the inventor of holistic medicine. Doctor, welcome to the show.
Delighted to be here.
Wow, I'm so excited. We talked on the phone the other day, and when I heard about your, I would say, pedigree, it was pretty impressive. So you started medical school at the age of?
19.
19. So at what age did you realize that you wanted to make a difference in the world?
4.
Okay, so what happened? What happened?
I just suddenly announced to my family, I'm going to be a physician. No physician in the family, that's what I wanted to do.
And they supported you. You told me that you had the most loving, supportive parents.
Yes. I've often said I didn't have the courage to choose abusive parents in this life. Being nurtured by your parents, to me, is the greatest gift you could have.
We talked about non-conventional, new ways, new things that you've discovered. How did you realize that there was a better way to treat the patient? Maybe not just going straight to surgery, but doing other things.
When I discovered that we could cure pain or control pain by stimulating electrically the spinal cord instead of with drugs, and all of a sudden it became almost a fad. And I was getting 400 people a year sent to me, and they were so devastated. They had 5 unsuccessful back operations, and they were on morphine and tranquilizers, and you know, there was nothing else to do but find a way to treat them. And I spent the last 40 plus years treating without drugs, 34,000 people, and we could cure pain, depression, anxiety without drugs, and most recently, opioid addiction.
It's interesting that you said that, because it seems like so many people are dying, especially that young, those 20-somethings. What's the difference between then and now? Why is it an addiction, and why are so many people dying?
I think that the problem is actually the pharmaceutical industry. I call it the pharmaco mafia.
Okay.
They have pushed these drugs, and physicians have been brainwashed by them to use them. I've had 6 major surgical operations myself. And the first thing I say when I wake up, don't give me any of that stuff. I think that narcotics should almost never be used, and certainly not beyond a week or 2 after most procedures.
Did you get a lot of pushback? Did people think that you were maybe a little crazy, a little mashugana, when you're like, oh, well, we're going to treat it holistically? People didn't even really know what that meant.
Well, most people still don't know what that means, but to me it means looking at the body, the mind, and the soul.
Okay.
We are souls, not people.
What was one of your early successes? I know you've had a lot with treating that many patients, but do you remember the first person that you were able to help and how that made you feel? Can you walk us through that? Yes,
it was a woman who had cancer of the ovaries, and she had been in pain for 7 years. And she was the second patient in whom I planted one of my electrical stimulators for control of pain. Total control of pain. Walked in, she couldn't believe it. She lived 7 years without pain.
That's lovely. Now, you have invented things.
Yes.
So tell us some of your inventions.
Well, I created spinal cord stimulation, something called TENS, or transcutaneous electrical nerve stimulation, cranial electrical stimulation for depression, anxiety, and insomnia. And my most favorite, the Gamma PEMF, pulsed electromagnetic frequency device. It puts the brain into gamma, which is woohoo, in the zone.
Now, it looks like an angel halo. Can you pass that over here to me, or show me how that works?
Yes, you put it on your head.
Okay.
But it can go anywhere on your body, and it puts the brain immediately, I'll turn it on.
Okay.
And now you are getting gamma frequency.
Okay.
And it recharges the electrical. Your brain normally has a minus 70 millivolt charge on it. If you're out of whack, it might be minus 40 and hyperactive.
Right.
Or if it's minus normal, you don't do anything. This puts it back to the optimal, which is 40 cycles per second. We have cured 6 chronic opioid addicts with this, but more importantly, for pain. It's a single, of all my invention, this is the best. For depression, for anxiety, it puts the brain back to normal.
You know what's so interesting? Remember what I told you was bothering me?
Yes.
You see how I'm holding this?
Yes.
My thumb has been driving me crazy, but we did this earlier, and look at the way I'm able to hold this. I mean, that's just a simple little testimonial, but I just noticed it myself. I'm able to grab this. I couldn't have done this before. This was killing me. It was really hurting me.
And, you know, I have lowered blood pressure from 200 over 100 down to normal. One woman that came in with 75% oxygen saturation within 30 minutes it was 96%, that kind of thing. It does help the body heal.
You know, I'm so effervescent. That's one of the words people use to describe me. If I work with this with you, Dr. Norman, I don't know, I might be like floating out of the room, but this is phenomenal. And I know that your heart is in the right place. May I push this button to turn it off? Okay, without like...
Just hold it for a minute,
I'll
it'll
hold it
go
for a
off.
second? Okay. So this is called, you named it after yourself, so it's Shealy Sorin Wellness.
Yes.
Okay. So this type of protocol, how many other physicians besides yourself are starting to use this?
Oh, probably at this point, several dozen.
Okay. And do you help train other people, like do
Oh, yes.
workshops and things?
I've done workshops for about 200 physicians just last month.
Oh, congratulations. That's phenomenal. Can I just celebrate you? You just had a birthday. How old were you this year?
87.
So
But I still feel 26.
You act 26 and you look 26. You are such a delight. Where's the future of medicine going? How can we implement more wellness instead of just treating illness?
By helping people get away from anxiety. Anxiety is the #1 stress reaction, and it is the foundation for all disease. We've known this for 110 years. Stress causes most illness. Learning to, my favorite word in the world is detach.
Okay.
If I can't change it, if I don't have the energy, the power, who cares?
Let it go. Let it go.
And that's where we are.
Excellent. I thank you so much. And again, happy birthday to you. I know that you're going to be traveling to Italy. You've got so many great things coming up on your agenda. If people wanted to follow you or work with you directly, they could go to your website?
Yes, just normshealy.com.
There you go. I'm going to turn this back on. Stay tuned for more. It really does work. Be well.